So after getting familiar with the non-lactose fermenters, now we discuss the lactose fermenters, and first one is E. coli. Very much tested, very much a lot of questions regarding a lot of connections from E. coli to other scenarios. So E. coli is actually a gram-negative but lactose fermenter bacteria. It has a virulence factor which makes it very much lethal. So the virulence factor, the first one is lipopolysaccharide, which goes to the toll-like receptor of the macrophages and leads to interleukin cytokine release 1,6 TNF alpha, causing the septic shock or sepsis. The second virulence factor is the K capsular polysaccharide, which can evade the phagolysosomal activity of the phagocytes and give access to the meninges and causes second most common cause of neonatal meningitis. The next one is P. fimbriae or P protein fimbriae, and this fimbriae it lead to adherence and adhere to the uroepithelium, causing cystitis and urinary tract infections, pyelonephritis, etc. Goes to the enterocytes, enterocyte, causing the dysentery and also diarrhea and diarrhea problem, and goes to the epithelial cells. And then we have Shigella-like toxin. We have known that Shigella-like toxin can inhibit the 60S ribosome, leads to dysentery. We will discuss in the EHEC subtype of E. coli. Then we have heat labile and heat stable toxin. Heat labile stable toxin is very much discussed in E-Tech and causing the watery diarrhea or gastroenteritis. So these are the virulence factor regarding E. coli. Then there is a lot of specific things regarding E. coli is lactose positive, E. coli is indole positive, which helps to differentiate Enterobacter from the E. coli. It is indole positive, which means that it can transform tryptophan into indole. Then we have we know that in the McConkey's it seeks. So one of the McConkey lactose positive, and also in the specific agar for this E. coli, it's eosinophil methylene blue agar stain, which helps to differentiate E. coli, giving the green metallic sheen. There is a lack of peron in the genome of the E. coli, which give lactase enzyme to be a lactose fermenter, and only one species E. coli hemorrhagic E. coli, enterohemorrhagic E. coli, which is non-lactose fermenter or non-sorbitol fermenter. Then in the classic galactosemic patient, E. coli can cause septicemia, galactosemia. There is a link for this galactosemic patient. They are prone to E. coli. And after this we have old men orchitis. So E. coli is one of the cause of old man orchitis. Then we have glucuronidase positivity, glucuronidase positivity. We have known that glucuronidase is the bilirubin deconjugator enzyme. When the bilirubin deconjugates, then there is an increase of the pigmented stones, and which leads to gallbladder pigmented stone, can causes acute cholecystitis, ascending cholangitis, and also leads to hepatic abscess. So glucuronidase positivity, orchitis, galactosemic, lack of boron, EMB, indole positivity, these are all important clues for diagnosis of E. coli. Now we have we have 4 species of E. coli. The first one is entero-invasive E. coli. It is invasive, it means it invade into the mucosa, leads to necrosis and causes dysentery. So it is the presentation is very much similar to Shigella. Then we have the EPEC. In the EPEC, P for pediatric, so it is most common in children. So children diarrhea is because of EPEC, and this is because of the fimbriae. Then we have the E-tech. E-tech mean for the travelers. So travelers goes drink water and causes and in the water we have the heat stable and heat labile toxin. So the heat stable toxin is overactivate guanonyl cyclase enzyme, leading to increase GMP and causing the decreased reabsorption of sodium chloride in water. So heat labile toxin overactivate adenyl cyclase and increase the level of CAMP, which can causes the include fluid secretion like cholera, and increase chloride secretion and water efflux. And then we have our most favorite EHEC, or enterohemorrhagic E. coli. It has the Shigella-like toxin, which is non-invasive. So this Shigella-like toxin, it inhibits 60S ribosome, leads to cell death and necrosis. There is a damage, it leads to damage endothelium. This damage endothelium triggers the platelets to come and repair this damage endothelial platelets come and repair, and in this repair process all the platelets are consumed. So in order to make microthrombi, now the platelets are consumed, there is a condition thrombocytopenia, and this microthrombi in the kidneys, it can decrease the renal blood flow, leading to acute kidney injury, and in the normal vessel it can leads to mechanically damage or mechanically mechanical hemolysis, leading to anemia. And on the photograph of the smear we have schistocytes, or the damaged fragmentation of the RBC cells. So there is a triad of this EHEC, in which there is we have anemia, then we have thrombocytopenia, and then we have kidney damage. So this triad give us the clue for try it. Give the clue that the person is suffering from E. coli. So after E. coli we have the Klebsiella, and in the Klebsiella is also lactose fermenter, and also it is a gram negative bacteria. So there is a mnemonic for this. So Klebsiella is A, B, C, D and E. For A, we have Klebsiella is caused by aspiration. Aspiration can cause aspiration pneumonia of the upper lobe of aspiration pneumonia, aspiration in whom, aspiration in the diabetic patient, aspiration in the alcoholic patient, and intravenous drug abusers which aspirate the normal oral flora into the lungs and infect the upper lobes of the lung, leading to pneumonia. Then there is an abscess formation in the liver and lung, which can complicate it as spontaneous bacterial peritonitis. And for the C, we have the appearance of this, which is currant jelly, means it is very much mucoid because of its polysaccharide capsule, and this capsule helps Klebsiella to evade or to evade the and this capsulated is we have discussed it in Please Shine My Skis, and in the case is Klebsiella. So Klebsiella is a nosocomial or hospital acquired urinary tract infection like stones and kidney stones and infection, and also it is multi-drug resistant. On McConaughey it gives lactase positivity, and it is also urease positive, leading to stone formation, kidney stones. So this is general information regarding the gram negative lactose fermenter bacteria.